blood supply to the larynx is through the laryngeal arteries, which are branches off of thyroid arteries. The superior thyroid artery branches off of the external carotid artery. The superior laryngeal artery branch will pierce through the thyroid hyoid membrane and supply the internal surface of the larynx. The inferior thyroid artery branches from the thyrocervical trunk, and the inferior laryngeal artery branch will supply the mucous membranes and the muscles of the inferior larynx. The superior and inferior laryngeal nerve branches of cranial nerve 10 innervate the larynx. The superior laryngeal nerve has two terminal branches within the carotid sheath, an internal and an external laryngeal nerve. The internal laryngeal nerve is the largest of the two branches. It's going to pierce the thyroid hyoid membrane with the superior laryngeal artery and provide sensory fibers to the mucosal membrane of the larynx. The external branch of the superior laryngeal nerve will descend posteriorly to the sternothyroid muscle, following the path of the superior thyroid artery. It will provide motor fibers to the cricothyroid muscle. The inferior laryngeal nerve is a continuation of the recurrent laryngeal nerve. We see an anterior and a posterior branch that follow the path of the inferior laryngeal artery. It will provide motor innervation to all the intrinsic muscles of the larynx, with exception to the cricothyroid muscle that we just discussed. It'll also provide sensory fibers to the mucosa of the infraglottic cavity. The pharyngeal plexus innervates the pharynx. Motor fibers of the plexus are derived from the pharyngeal branches of the vagus nerve. The plexus will provide motor innervation to the muscles of the pharynx and the soft palate, with exception to the stylopharyngeus and the tensor veli palatini muscles. Sensory fibers of the plexus are derived from the pharyngeal branch of cranial nerve 9. The plexus will provide sensory fibers to the mucosa of all three parts of the pharynx. Recall that the inferior laryngeal nerve provides innervation to all of the muscles of the larynx, with exception to the cricothyroid muscle. If there's any damage to this nerve, it can lead to paralysis of the vocal folds. The muscles that are able to adduct the vocal folds and allow for normal voice production would be impaired, and our patient would present with trouble speaking and producing sound. The superior laryngeal nerve innervates the cricothyroid muscle. Any damage to this nerve would paralyze the cricothyroid muscle and prevent our patient from being able to change pitch or make any explosive sounds. Damage to the pharyngeal plexus, which innervates the muscles of the pharynx, would cause difficulty swallowing.